Hello everyone, we are back with another lecture on basics of forensic medicine in India. This lecture is also regarding the history of forensic medicine in India. So I am Dr. Jaspinder Pratap Singh, Assistant Professor and Head in the Department of Forensic Medicine and Toxicology, Shri Mata Vaishno Devi Institute of Medical Excellence, Katara. In this lecture, we get to know about the introduction of forensic medicine, regarding the history of forensic medicine, clinical forensic medicine, forensic pathology, state medicine, as well as the medical jurisprudence. Forensic medicine is basically of two things. The subject of forensic medicine includes forensic medicine as well as the medical jurisprudence. So coming to the history, to protect themselves from the charm and effect of magic and witchcraft, ancient men framed some set of regulations which was the origin of medical jurisprudence. In 3102 BC, Manusmriti prescribed specific rules for marriage, for punishment of adultery, for mental incapacity due to intoxication, illness, and age. These were recognized. The first treatise on Indian medicine was Agni Vesh Charaka Samhita, and it was introduced in 7th century BC. It mentioned about various trainings, duties, privileges, and social status of the physician. It can be considered as origin of medical ethics. It also mentioned regarding various poisons, their sign and symptoms, as well as their treatment. Around 4th and 3rd century BC, Arthashastra of Kautilya was the law code. The penal laws were very well defined, medical practices were regulated, and the medical knowledge that were utilized for the purpose of law. In Sushrita Samhita, which was composed around 200 to 300 AD, the chapters concerning the forensic medicine were very much carefully written. In 1822, the first medical school was established in Calcutta, and that was later changed to Medical College in 1835. And there, the first chair of medical jurisprudence was instituted in Calcutta Medical College in 1845. And Dr. C.T.O. Woodford, he was the first professor of medical jurisprudence in this country. So coming to the meaning, the literal meaning of forensic medicine. The forensic comes from the word, a Roman word, forensis, which means forum. Now in Roman culture, the forum was the meeting place where civic and the legal matters used to be discussed. The forensic thus means forum of or used in the court of law. As you all know, the word medicine may broadly considered as science for preserving health and effecting cure. From the interaction of these two professions of medicine and law emerged another discipline or the subject of forensic medicine. Thus, the forensic medicine is defined as the application of medical and paramedical knowledge to aid in administration of justice. Forensic medicine basically deals with the medical aspect of law. Earlier, forensic medicine was also called as medical jurisprudence or was also termed as state medicine by Dr. Stanford Emerson Chelly in 1949. In Western areas like US and Europe, they often prefer the term legal medicine, which broadly means the application of medical knowledge for the solution of legal problems. Forensic medicine guards the safety of each individual and ensure that any accused is not unjustly condemned. Thus, it is essential for an expert of forensic medicine to have a fair knowledge of all the branches of medical as well as the ancillary sciences. Thus, understanding certain provisions of law which falls under IPC, now known as BNS, Criminal Procedure Code, now known as BNSS, Indian Evidence Act, which is now known as BSA, various other acts like MTP Act, THOTA, PNDT Act, Consumer Protection Act. These are very essentials for the forensic medicine expert. Now coming to another term, clinical forensic medicine. It deals with all the provisions of clinical services, which includes the diagnosis, treatment and the management to the patient. Now it is the clinical forensic medicine means the medico-legal aspect of the patient care. Clinical forensic medicine includes the medico-legal examination of injuries in the case of physical assault, in case of sexual assault, the determination of age for medico-legal purpose, medico-legal examination of drunkenness, impotency, any psychiatric assessment of a person for insanity related to criminal cases like murder, competency as a witness, validity of consent, any testamentary capacity in executing a will. Another main discipline in forensic medicine is the forensic pathology. It deals with the scientific examination of the dead bodies for medical legal purpose to determine the cause, manner of death in case of any violence, any suspicious, unexplained, unexpected, sudden and medically unattended death. Another discipline in the forensic medicine is the state medicine. In this, the application of medical knowledge to prevent the spread of disease. Thus, forensic medicine was also once known as state medicine when it deals with rules and regulations and other do's and don'ts which are to be observed by the registered medical practitioner. Now, some duties or the statutory duties of a registered medical practitioner are information to the health authorities regarding the births, deaths, notifiable diseases, any type of case of poisoning from any kind of establishment. Coming to the medical jurisprudence, it is composed of two words, juris and prudentia. Juris means law, while the prudentia means knowledge. It deals with the legal aspect of practice of medicine, application of law to medicine. Now, various legal responsibilities of a physician with particular reference to those arising from doctor-patient relationship, doctor-doctor relationship, as well as the doctor-state relationship. Now, coming to doctor-patient relationship, if there is default on the part of a doctor to provide standard care, may render him liable to the damages. If that resulted in physical or mental injury to the patient or monetary loss to the patient. The examples are the various types of the negligence on the part of doctor. It includes the malpractice, the wrong diagnosis can be included in this. Another relationship is the among the doctors, that is doctor-doctor relationship. If a doctor is criticizing his colleagues or doing anything that means unfair competition, is liable to the consequences. Another is the doctor-state relationship. A doctor is liable to face consequences if he does not attend the court to give evidence or information to the court, or inform the police if he comes across any case of homicidal poisoning or suspected homicidal injuries. He did not inform the public health authorities regarding the notifiable diseases. So this sums up the chapter or the lecture of basics of forensic medicine, which included the history of forensic medicine. I hope you like it. Like, share and subscribe this channel. Thank you.